Gender parity drives peace, progress, and prosperity. Islamabad showcases ethno-cultural diversity of Pakistan, with 3 rural zones and 2 urban zones shadowing Pakistan's total rural-urban divide. It offers a clear view of gender realities. The Islamabad Gender Parity Report is a data-driven initiative that highlights gender gaps, their causes, and their impact. It meets both local and global standards. Led by the National Commission on the Status of Women and the Ministry of Human Rights in collaboration with UNFPA, this report is part of the Prime Minister's Women Empowerment Package. With a framework of 237 indicators and data available for 170 indicators, it is Pakistan's most detailed gender assessment. Achieving gender parity could increase GDP by 30% and free 50% of the health budget. The benefits would be far-reaching. The Gender Parity Index assesses socio-economic, political, and legal access for women. This report supports Pakistan's commitments to SDGs 5, 3, 4, and 8. It also aligns with the Convention on the Elimination of All Forms of Discrimination Against Women, ensuring equal rights in education, healthcare, and employment. Islamabad's population is growing. Among young people between 15 to 29 years, gender proportions are nearly equal, requiring investment in education, jobs, and healthcare. Rural zones grow twice as fast as urban ones. Gender disparities persist in legal identification. Many women and transgenders lack CNICs, restricting access to financial and legal rights. Women remain underrepresented in politics. The National Assembly has 21% female members. Women hold 15% of public sector jobs. At higher ranks, the gap narrows, where 43% are women. In the private sector, representation is lower. Only 4% of Islamabad's Chamber of Commerce members are women. Just 2 of 26 executive seats belong to them. Women dominate nursing professions at 80%. 42% of public sector doctors are female. Women account for 49% of mental health patients, reflecting the gendered burden of psychological stress. In maternal health, 40% of births at surveyed facilities were via C-section. Only 2% of newborns had low birth weight, which is a positive sign. Yet, vaccine coverage remains uneven. 30% of women who received the first TD vaccine do not get the second. Gender parity in early education is strong. Girls' net enrollment outnumbers boys in middle and high school. Yet disparities emerge in higher education. Women excel in health sciences but lag in engineering. In technical training, only 41% of enrollees are female. Women make up 87% of private school teachers but just 4% of university vice-chancellors. Only 23% of women in Islamabad are in labor force. Social norms, wage gaps, and mobility restrictions limit their opportunities. Half of working women are employed by agriculture sector compared to just 5.5% of men, showing limited opportunities beyond traditional roles. 17% of women are unemployed. Financial exclusion remains a challenge. Women own just 9% of bank accounts and only 4% of registered vehicles. Land ownership follows a similar pattern. 75% of owners are men. Women's presence in the judiciary is rising. At the district level, 41% of judicial officers are women. Yet, senior positions remain male-dominated. 3 female judges hold positions in the superior judiciary in Islamabad's courts. 22% prosecutors in Islamabad are women. Still, progress is visible. Islamabad police have established gender and child protection units to address violations against women and children. The report calls for action: expand women-friendly transport, improve urban safety, and enhance public mobility. Boost employment programs, digital literacy, and public spaces for women. Strengthen CNIC registration, legal awareness, and electoral reforms. Implement a one-patient, one-ID system to improve maternal and mental health services. Develop mentorship programs and affirmative action for female leadership. Promote flexible work policies, financial literacy, and microfinance access for women. Ensure equitable recruitment of female judges and strengthen gender-based violence response. A future of parity is within reach. Let's build it together.